Hello, good afternoon to everyone. I'm Dr. Sandeep Gajbe, Associate Professor, Viva Institute of Pharmacy, Virar, Maharashtra. I am want to present the PPT on a tablet. So, tablet is basically unit solid dosage form. It is basically from I am basically from the pharmaceutics background. Rather, I am associate professor in uh, pharmaceutics. So I am basically from the pharma background, pharmaceutical sciences. So I'll present my PPT uh, dosage form. The tablet, all of most of the people knows the tablet dosage form. No one will be the person who has taken the tablet in his life. So everyone has taken a single tablet at least once in a life. So tablet is basically a dosage form which is uh, intended to use for the cure mitigation of the individual. Okay, so we will just see the some part of we will just go through some history of tablet is basically used in very ancient time. It is actually patented and patent grant in 1843. Okay, like a pills and lozenges. Then in 1980 there are 300 monograph of the tablet has been uh, patented out. Okay, and it is documented, and we can say that most of the dosage form, most famous dosage form is a tablet dosage form. There are capsule dosage form, that there is a parental dosage form, we can say the parental, but most famous dosage form is the tablet. Okay, so what is the tablet? Tablet are a flat biconvex disc of unit dosage form containing one or more active ingredient, which is compressed along with the necessary additives. Okay, so it is basically a concave in shape. It is a disc which is containing either one or more excipient, including the active ingredient. That active ingredient we called in our language as a drug, which is the active moiety, which is compressed in a tablet coating machine, tablet compression machine with necessary additives and excipients. Okay, so we'll see these are the some types of tablet which is injected orally. Most of the tablet we take orally. You can see in a picture there are a number of tablet in various color shapes. Okay, so basically a simple tablet is nothing but called as a compressed tablet. Okay, it has a more systemic effect and a local effect. Systemic effect means a localized effect sometime, and most of the time is taken locally. Okay, it has advantages that it has rapid disintegration and dissolution time. It get readily released in our body and will give the pharmacological action. Okay, mostly in localized defect we can say that antacids and adsorbent are to be taken for the localized defect. Okay, then multiple compressed tablets. So it contains now here 2 to 3 layers of the tablet which contain more than one drug, or we can say that more than one active pharmaceutical ingredient. So we can say that one tablet contains the two drug. So one tablet can be used for the two type of the disease, or we can say that it can be used for the two type of the uh, disorders. Okay, so one tablet can do the work for the two disease or two uh, we can say that we can cure the two type of the problem. Okay, in one tablet. So we don't have to take the two tablet for the two different disorder. Okay, so you can see here the tablet which is ingested orally, it has a core, it has a coat. Okay, you can see the cross sectional area. It is very compatible. The main ingredient of a tablet is active ingredient. Then second is the diluent which gives the bulkiness to the tablet. Third is disintegrant which get kept the tablet in a disc shape. Okay, and fourth is the disintegrant which kept the tablet in a small granule form. When it absorb the water in a body and it will get burst. So tablet should contain the binder, it should contain again disintegrant, because once we take a tablet, tablet has to come in our GI tract, then it will get disintegrate in our stomach. So in stomach, the tablet disc will be converted into a small granules. Okay, in a stomach, then it will go to the intestine, where it will be converted into a powder and it will get dissolved. So the tablet manufacturing, we take a powder of all excipients and active ingredient, we convert it into granules, and then granules will be punched out to make a tablet. So from powder to granule, and from granule to a tablet. Exactly opposite will be happen in our body. We take a tablet disc, okay, it will then reverse back, converted into a granule, and granule will be converted powder, and powder will get dissolved in our body. So whatever we taken to make the tablet outside body, exactly the opposite will be happen in our body. So that is called as the pharmacokinetic and pharmacodynamic. That is a part. And you can see here the tablet ingested orally, repeat action tablet, delayed tablet, sugar coated tablet. You can see the gems, whatever the small children's chew, that gems is nothing but the sugar coated tablet, because small children's doesn't like bitter tablet, so we have to coat it with the sugar. Then we have to coat it with the color, so that they can be attractive. That is called as the organoleptic characteristic we have to increase, so it will be easily taken by the children. Otherwise children will not take the tablet. Okay, then film coated tablet. Okay, it has a some tablet which has a bitter in taste, we have to coat it. We coat the tablet, and you can usually take it. Okay, chewable tablet. Gelusil is the best example of the chewable tablet. We have to take it, chew it, and it will go in our stomach, and acidity will go. So that is the example of the best example of the chewable tablet is the antacids. Okay, Gelusil we can say. Okay, Gelusil is a brand actually. Then sublingual or buccal tablet, which is to be kept in the oral cavity. A buccal tablet is in buccal cavity. We have to take the tablet, and we will fix in the buccal. The drug will get released slowly. Sublingual tablet below the tongue. Whenever we take the tablet, the sublingual tablet will be for the emergency use. Whenever the patient will be having angina pectoris, or we can say the heart attack, sudden, then we have to take the tablet and sublingual, and it will get ingested in our body. Very fast action. Whenever the patient suffer a heart attack, massive heart attack, we have to take the tablet and kept it below the tongue. That tongue, it will be directly absorbed, and it will increase the pulpination of the heart. Okay. Then troches and lozenges, which is mainly used to treating the sore throat and coughing and cold. Okay. Dental cones, which is used to design to place the empty socket which is in the after extraction of the tooth. Okay. Then implantable tablet, which is used to prolong use of drug, because sometimes we have to take the drug. Some drugs are to be used for the life-saving drug, and it is to be taken for 10 years, 20 years, 25 years likewise. So whenever we take a drug or a tablet, it is an n number of side effects. To reduce the side effect, again to decrease the increase the patient compliance, we have to implant the tablet. And some the tablets are to be made, we have to make a cut, we have to place the tablet inside it, we have to sieve it, and the tablet will slowly get released in our body. The drug will get released for longer period of time. Okay, we have to take cut, we have to make small surgery, we have to put the tablet inside it and then sieve it. The tablet will get dissolved. Okay, vaginal tablet is just basically kept in the vaginal cavity, and it will get released. Then tablet, these are the some effervescent tablet and dispensing tablet. Hypodermic tablets are there. Effervescent tablet basically these are the Dispirin is the best example of the effervescent tablet. Whenever we put it into the solution, there will be the release of the carbon dioxide. You can see the bubbles. Okay, so that is the effervescent tablet. Okay, hypodynamic tablets are there. What are the advantages? Basically, large manufacturing can be made with the lowest cost, so it is bit cheap. It is packaging is easy, shipping is easy, and stability is more. So this is a main advantage of the tablet. Okay, it is also use easy to handle. Okay, whenever we take a bottle, a syrup bottle, and compare to the tablet will be easy for the handling rather than the syrup in traveling and all. Okay, it is light in weight, you can carry it anywhere in park or pocket also. So tablet is basically easy for the transportation, it has the more stability. Okay, disadvantages, uh, slow dissolution, immediate uh, drug release will not be happen with the tablet. Okay, like a parental dosage form, or we can say the injection will give the immediate side effect rather than the tablet. Okay, it has a, and then what again tablet has a poor weighting. Again, the tablet one disadvantage of the tablet is we can't give it to the pediatric patient, geriatric patient, and again the patient which is unconscious. We have to take give the drug with the saline solution also. That is called parenteral. So for the geriatric patient, that is old age, pediatric, small children's, and for the unconscious patient, we can't give the tablet. That is a major disadvantage. Okay. So these are the ingredient drug, that is the API diluent, so that is due to the bulkiness, then disintegrant, then lubricants are used. Okay, disintegrant is basically used to promote the breakage of the tablet. Okay, it will rapidly release the tablet. Binder is basically used to either uh, make the tablet granules into one place. Okay, these are the some examples. Lubricants to increase the flow of the granules in a hopper, so that the drug will be get punched into the tablet compression machine. There are glidants to reduce to improve the flow properties of the granules. Okay, these are the some examples. Caboseals, then aeroseals, cornstarch, talc, many more. Okay, antiadherent basically are the cornstarch and starch and metal steroids, which is used as an antiadherent to decrease the wear and tear of the tablet basically. Okay, so these are the some organoleptic agent, that is sweetening agent, sugar, mannitol are used basically for the uh, coating of the tablet. Sugar, basically it is used in sugar coating tablet. Coloring agent is used for the film coating tablet. Now these are the organoleptic. We can take the example of the James. James have n number of colors are there, which is coated with the colors and sweeteners. Okay, so James tablet is one of the best example of the sweeteners and coloring agent. Flavoring agent you can take as in a chewable tablet, basically in a gelusil tablet. Then granulation, particle size and shape you can take. Okay, some there are two basic method of the tablet formation. One is the wet method and second is the dry method. Wet method is basically wet granulation. The dry method will be done by the dry granulation and direct compression method. So these are the some steps involved in the wet granulation. These are the some step which is taken in a dry granulation. Direct compression is basically used for the MCC, that is the microcrystalline cellulose. Okay, these are the some compression. You can see here the picture how the granules will comes, lower punch, upper punch, and how the tablet will be punched out with the help of the granules. Okay, multi-stationer rotator you can see here. Okay, you can see here. These are the some design of the tablet punching machine. Okay, there are 18 station, 16 station. So 16 station means what the 1/16 tablet in 1 second. So you can imagine, you can see here the whatever the uh, reddish color, or rather you can say orange color. These are the tablet, and tablet you can see here the tablet forms, how the tablet get forms. Okay, You can see here the granules will become, then lower punch will be slightly low, upper punch will go, then upper punch will be directed downward side and it will get compressed, and the tablet will be get ejected whenever the lower punch get uh, uh, lift in upward direction. You can see here the tablet formation of the tablet from the granules. Okay, then the processing problems in the tablet, basically there are some problems which is uh, happen or occur in processing of the tablet, or rather making of the tablet or manufacturing of the tablet. Basically capping, there is the formation of cap on the top and bottom of part of the tablet. So basically on main body, you can see here in the picture, due to the picking and chipping of the upper and lower punch, it will get stick, so it will form as a capping. You can see here lamination, due to the over compression and more entrapment of the air, there may be the chances of the lamination. Checking and picking, you can see here the picking and sticking of a tablet with each other, with the tablet with the upper and lower punch, and sticking of the tablet with each other, and sticking or picking of a tablet with the upper and lower punch. You can see here the mottling. Mottling is particularly an uneven distribution of the color on the tablet. You can see here it is not uniformly distributed. It is uneven distribution of the color. Basically, it is happening in happens in the film coating and sugar coating tablet. So pure mixing, these are the some wet variation. You can see the evaluation of the tablet is basically shape and size, then identification, then weight variation of the tablet is one of the evaluation parameter of the tablet. Third is the content uniformity, basically. Fourth is the hardness of the tablet. Okay, then fifth is the friability test, how it is a brittle one, and this friability test is done by the Roche Fiabiliter. Hardness is by the Monsanto and Pfizer type of the hardness tester. Okay, here we go. That is the disintegration test. Disintegration test is done by the two ways. One is basket type and second is the paddle type of that disintegration machine. One is the IP, that is the intern pharmacopoeia, and second is the United States pharmacopoeia. That is two type of the instruments are there which is to be taken for the disintegration test. Okay, so uncoated tablet, the tablet should be disintegrate within the 15 minutes. If it is not, then we have to optimize it. The sugar coated tablet, the tablet should be disintegrated in our stomach in 60 minutes. Film coating tablet 30 minutes. So we have to make that whenever we make a tablet, it should fall in this category and it should follow this standard. If it does not fall in the standard, we have to make it optimized. Either we have to increase the disintegration time or we have to decrease the disintegration time. Okay, so dissolution, you can see that how the apparatus looks like. Okay, so one is the rotating basket type, second is the rotating paddle, reciprocating, then flow type cell, paddle type cell, cylindrical, reciprocating, this type of the disintegration machine. Okay, this is very important because whenever we take a tablet, it should be disintegrated. If it is not disintegrating, then what is use of the tablet? So it should get disintegrated in our stomach, it should be get dissolved in our intestine, and it should pass in our blood, and then it should go to the whatever the part of the action, or we can say it should show the pharmacological action whenever we want it. It should be go to the target receptor, and drug will get bind with the receptor, and it will then get show its pharmacological action. Okay, like simple tablet, when we take a paracetamol tablet for the antipyretic, we can say that pyresis means increase in a temperature of our body, that is the pyrexia or pyresis. So it is antipyretic, it will decrease our body temperature. So how it will decrease? When we take a tablet, it will be go in our stomach. In stomach, it will get burst due to the absorption of the water. It will get burst into small granules, and that granule will be dissolved in our intestine, and then from intestine there are blood vesicles are there, which is surrounded to the intestine wall. Through this wall, the drug will get diffused into the our blood, and then blood will be circulated throughout our body. And whenever the receptors is there to bind the drug, this drug will go to that receptor, particular part of the body, particular part of the tissue or a cell, and it will bind with that cell, and it will show its pharmacological action. And slowly that receptor will be bind to the drug, and this receptor will show its rather a drug will show the pharmacological action by decreasing the temperature of our body. So aspirin will do, or paracetamol will do like this. Okay, we have to take tablet, it will go to stomach, intestine, blood, and to the pharmacology, whatever the site of action, it will go to that site of action, and that's it. Okay, it's a short, actually, very in very few words we can say. Then that's all. Thank you. These are some references. Thank you.